Good morning, everybody. Good morning, everybody, and welcome to AM Impact on Your Health. AM Impact on Your Health, where every day our goal is to have you learn at least one thing to help you live better and longer. AM Impact on Your Health is heard each and every Monday, Wednesday, and Friday from 8 to 9 o'clock. I'm Dr. Dennis Courtney, and I'm with you each and every Monday, Wednesday, and Friday from 8 to 9. AM Impact on Your Health, where each day you'll find current medical news, knowledgeable guests, fascinating health topics, and of course, where we do encourage you to call in to join in today. Well, a special lady with a special day. We put Mondays aside each and every month to continue to bring more information about a topic I believe is a great paradigm shift for us here in the office and here in Western Pennsylvania. Things are moving in the realm of microcurrent, and the expert on microcurrent is our guest today. She's Ms. Shannon Goosen. She hails from Jacksonville, Florida, but she's been involved and been at the forefront of microcurrent therapy as it has grown over this last decade, and she's our special guest today. She has a special tie to Pittsburgh. She's going to be involved with getting our programs up and going. You, the listener, will be intrigued by the variability and how effective microcurrent therapy actually can be. So, we got a thing called Microcurrent Mondays. Today is one of those Mondays. Shannon Goosen is our guest today. If in the course of our discussion with Shannon, you want to call in to ask a question or to make a comment, the number, of course, is 412-825-6262. That's 412-825-6262. I'll give that number additionally throughout the hour. Microcurrent Monday for November will take place today. All right, let's see how the schedule is shaping up. Of course, we have a large eye program today. We begin our 3-day eye treatment program for the month of November. Looking forward to that. I'll report back to you how patients are doing on Wednesday. And, of course, this 3-day program is something in the future you may want to become involved with. If you have any serious eye disorder, things like macular degeneration and glaucoma and diabetic retinopathy for sure, some more and other rare retinal problems. I think that's the key word. If it's retinal, it is really something that microcurrent and the Chondrod program can really help. So give us a call and talk to Sister Sarah at 724-942-3002. We'll try to get you more information. You, of course, can head to the website at pittsburgheyeprotocol.com. That's pittsburgheyeprotocol.com. We have described the program to you. We've linked onto Dr. Ed Chondrod's website entitled Healing the Eye and Wellness.com. And between the two, you'll get a pretty well-rounded look at what these programs are all about. The eye treatment program begins today here in the office. Now, this weekend, and we had Susie Weiss with us last week. Came to the office, had her little group out there who were learning more about essential oils. But this is the big weekend for Susie because her annual event held at the Embassy Suites out there at the Charrington and in Moon Township is going to be held this weekend. Now, if you are not affiliated with Young Living at all, it's an open invite to you. You're welcome to come. They only ask that you register prior to coming, and you can do so by going to eventbrite.com. That's eventbrite.com, and be able to do that pretty easily right there. If you are involved with Young Living, you have to get a ticket. It's $25 in advance, $35 at the door, all day, 9 to 4 at the Embassy Suites out there in Moon Township, Charrington Plaza, and I'll see you there. I'll be in some panel that they've asked me to serve on in the morning. Hopefully be able, if you have questions and you'd like to ask me some specific questions, I should be around long enough for that to happen. So that's this Saturday. Talk to you more about that on Wednesday. I'll be swinging in to the last weekend, the Thanksgiving weekend, coming up, and pretty much things are wide open right now. Of course, we won't do a live show on Friday the 28th, There'll be some slots in between now and then. As we move into the month of December, you're going to be enthralled by a guy, Dr. Ty Vincent. He hails from Wasilla, Alaska. Somebody you know from up in Wasilla, maybe? Ever heard of her before? Anyway, he doesn't know her, but he's going to be our guest. He'll be on the show here on the 8th. A little tricky because he lives in Alaska. They're 6 or 7 hours behind, and he flits back and forth between Alaska and Hawaii, so they are 6 hours behind. We're going to record the show on the 5th. I'll play it for you on the 8th. It won't be a live show. You won't be able to call in, but that's just about the only way we can pull this off with such a distance in between. Anyway, the topic is what is so important here because LDA that we've been involved with for a couple of years now. We launched it in November 2012. Those shows are still on the website. I encourage you to go back and re-listen to them with Dr. Schrader on the first. It was every Friday was an LDA Friday back in 2012, and the first Friday was with Dr. William Butch Schrader himself. The second Friday with John Wyckoff talking about autoimmune diseases, and the third and the fifth Friday with a Thanksgiving sandwich in between there was Dr. Kathleen Janelle, a naturopathic gastroenterologist from the state of Washington. Anyway, they're good reviews, but Ty has picked up what he learned from Dr. Schrader, and he has moved into a new arena. You're going to really enjoy hearing how successful he has been by taking the general information from Butch Schrader and moving into an arena that allows him to conquer some pretty serious diseases. But all I'll say is with Lyme's, if you are a Lyme's victim, and you are a victim, and you just can't seem to shake it no matter what you do, whether that's alternative or conventional, you're going to want to pay attention because he's batting 38 out of 40. I don't like to use the C word, but these people don't have symptoms anymore. And it all surrounded around this treatment called LDA. And you're going to be with us on the 8th of December. You'll hear the show on the 8th of December. And then he'll come back in January. And I can give you the date on that one. That's going to be the 12th of January that you'll hear him. He won't be live, but you don't want to miss those two shows. They'll be platinum shows. And they will mark the launching of an accelerated way of utilizing LDA. Of course, that stands for low dose antigen, and more about that in up and comings. Beresha, oh my goodness, the last couple of days. Saturday we were down at the Carnegie Science Center for the JDRF Walk for the Cure presentation. We were sort of in the lobby down there, met an awful lot of you, really enjoyed that opportunity. And then yesterday, that function put together by Aaron Hart, who discussed this thing about the farm-to-table tastings. What an uproarious success that was. It was held yesterday at the Pittsburgh Public Market down there on Penn Avenue, and the place was packed, and there was all sorts of activity, people moving around, having a free tasting at, I don't know, there must have been 40 or 50 under one roof down there, vendors, all with their offering. We were there with Dr. Angelo Mitzos, Sister Sarah was there, Dawn was there, Keith was there, all educating people on the Beresha products. And plenty of you came over. If you are listening today, maybe one of the first timers, because I know many of you asked about the radio show. You may be tuning in today. I want to thank you for stopping by yesterday. Become more aware and educated on this Beresha line, a unique line of products. Go-to drinks, whether it's the coffee, the tea, or the lemonade, that is able to satisfy your thirst in a very healthy way. Remember the 4 things that these products do. These drinks do that I don't find any other line is able to meet. All 4 of these. First, thermogenicity. Anytime you drink one of these drinks, you burn fat just by having drank them. And we've had people come in and give us some amazing testimonials by just having drank these, whether it was the coffee, the tea, or the lemonade. They're losing fat and just by having drank them. So we're getting verification on that. Second is that they're satiety quenching. You drink any of these drinks 30 minutes before a meal, and you won't be eating much at that meal, or at least not as much as you originally thought you were going to be eating. They're all hypoglycemic. I think that's a standard term in the industry, so you're not going to have any undue pressure put on the endocrine system, and particularly the pancreas. And then finally, the real connection, the one that's never mentioned, is that they blunt the cephalic response. I haven't heard anybody even talk about the cephalic response. This is when anything sweet hits the tongue automatically. You don't even have to swallow the stuff. Whatever it was that hit that tripwire, you have a gush of hormones, particularly insulin, as though you were eating a plate of spaghetti and you didn't even swallow this stuff. Anyway, learning that there is such a thing called a cephalic response really puts all the other go-to drinks in another category, one that's of lesser quality, because if it's sweet, it is going to hit that tripwire, but the Beresha products do not cause the gush. And that's why I say the combination of those four things make them extremely interesting. If you want to learn more about them, listen for another tasting. They're literally all over the place. One's going to be in your backyard soon. If you can't wait, either come on in the office. We'll make sure you get a sample or two of what we've got. Or you can just go online. Go to PittsburghEyeProtocol.com. And once their opening banner up on top says products, click on the product icon. That'll take you to a list of all the products I endorse. But right at the top of the list is Beresha. And with it, you'll be able to be guided to sort of sign it up to get these products delivered to you. Okay. I think that's about enough of the preliminaries. Let's do this, folks. I'm going to take a short break. In the interim, we're going to connect with a very good friend of mine, but what a competent clinician when it comes to the use of microcurrent. You're going to be learning more about microcurrent. Get ready for a Pittsburgh major paradigm shift happening no other place other than here. You're going to learn all about it through Shannon and myself. Be right back in a moment. Good morning, ladies and gentlemen. Welcome back once again to AM Impact on Your Health. Heard here on KHB 620 each and every Monday, Wednesday, and Friday from 8 to 9 o'clock. I'm Dr. Dennis Courtney with you today on the Monday morning version of the show. And as you're going to come to be accustomed to, special Mondays around here, because we're setting one Monday aside each month to continually pursue a theme, a paradigm shift, if you will, in where we find everything going, at least in this office, and pretty much the newest thing on the block, something called FSM, otherwise known as frequency-specific microcurrent, and the expert on FSM is our guest today. Now, she hails from Jacksonville, Florida. We've known each other for many, many years. She went off one branch, I went off on another. We're now reunited, sort of sharing our journeys in separate venues, but now with a common cause. Microcurrent is it. Let's say good morning and welcome back to our airways, Ms. Shannon Goosen. Shannon, good morning and welcome aboard.
Dennis, thank you. I'm glad to be back on the show, and I am really, really very glad that we are going to be able to start this regular series to get people more educated, and I am so glad to be working with you again and to have had our paths cross and that we get to collaborate on getting the word out on this wonderful, wonderful modality, microcurrent. So thank you, Dennis.
Well, I extend that invitation to you, of course, as we you and I know each other for a long time, and our listeners will become a part of how that relationship really began way back in the 1990s. But so many times as we do a show, people go, well, I wasn't here the first time around. So for those that were with us last month, please bear with us. If you had not been, I would really love for you to meet this young lady, such a vibrant and intelligent gal who has pursued a form of medicine that I'm just coming to recently. She's been involved with for quite some time, called microcurrent. So Shannon, would you please, because I thought you did a great job last month, tell our listeners how you describe when you're asked, what is microcurrent therapy?
Well, microcurrent is the use of current through the body that's delivered in millionths of an ampere. And because the amperage is so low, and the way this microcurrent therapy is delivered, you really don't feel it go into the body. It's completely subsensory. However, your nervous system and your tissues know that the current's coming in because it's the same level of current that the body is using to function and operate. So the body totally knows what to do with this current when we apply it, and it changes the tissue. I was really fortunate that a lot of my mentors early on, in different ways, were talking about microcurrent, which has been around for decades and decades and decades, and some of the earlier frequencies come to us from the late 1800s. So even though people may be hearing about this for the first time, there's thousands and thousands of practitioners and doctors that have known about the value of putting microcurrent in the body. And my earliest mentor, Jeff Rockwell, talked about using microcurrent to calm down the tissue after we had done body work, to help tissue regenerate and to calm down the nervous system. And then in 2000, I was introduced to Carolyn McNakin, and she is a chiropractor who lives in Oregon. And Carolyn had started using microcurrent. So early on, I had all these different exposures, and then I started to get to use it in my practice in a variety of different ways. And it was not long before my practice in 2006 and 2007 was almost completely using frequency-specific microcurrent along with all of the other modalities. I'm also an acupuncture physician. I'm a licensed massage therapist, a myofascial pain specialist, which of course, Dennis, how you and I got to know each other in the early 90s.
Yeah.
And I have included this since that time and have been able to really, really hone in on what frequencies we need to use to change what is happening with people's health, reduce their pain, help them with healing, and improve their mood. There's things that we can do to help brain health and deal with concussions, which is really, really hot topic right now because we have so many people coming back for more with concussions, and even things like post-traumatic stress disorder. Of course, you were at the CASE conference this year and I presented that case, so that's bringing us up, Dennis, about 15 years of this full progression to where we've really, really been able to put frequencies together and hone in everything from treating myofascial pain to getting rid of fibromyalgia pain to modulating the nervous system to help with closed head injuries, with people that have separate care of the trauma. So I am so fortunate that this is how I get to practice medicine in the 21st century.
Well, as we begin to educate the listeners in Western Pennsylvania and bring to them this 21st century medicine, I can't help but think there's somebody sitting out there right now go, oh yeah, I know about that. I used to have one of those 20 years ago, and I got this sort of apprehension and fear that the public may be equating something like TENS units, something that's been around for a long time, and just saying, oh, I know about that. That's something I had a long time ago. When you're confronted with people who've confused the two, how do you set them straight? Because I think that is a very important step to take right now.
Dennis, that's a really important step to take right now, because not only do patients think they've had this type of therapy before, but if a patient who is getting microcurrent therapy, and specifically when we use specific frequencies for conditions and they go to their doctor, the doctor will even say, oh yeah, that's TENS. Well, it's not. TENS is delivered at a much higher amperage so that you can actually feel it. So TENS was designed in order to block pain signals getting to the spinal cord and getting to the brain. So it actually goes off the understanding that nerves get to our brain at different speeds. And when you use TENS, you are actually activating those nerves with information that will get to your brain faster, and it stops information about pain coming in. The TENS was used for pain control while people were recovering after surgery or had some terrible accident, but you can feel it. And it's usually not really comfortable when you put it on, because there is a tingling sensation and it can actually make your muscles contract in an uncomfortable way. It's completely different. And not only that, the one thing I would want your listeners to know about TENS, if you have a TENS unit in your house, they actually interfere with ATP, which is the energy production in the body, adenosine triphosphate, and it's something that gets generated inside the mitochondria, and that is your power plant that makes your muscles work, your heart work, your organs work, your brain work, and TENS used over time will actually diminish the body's production of that, and it wastes it. So if you are trying to heal from something, you actually don't want to be using TENS. It's counterproductive.
Yeah, now, excuse me, I don't want to interrupt. I'll make a comment in a moment. Take it right away. Go to the next point you were going to make.
The next comparison for this is that microcurrent, by contrast, in all of the studies that have been done over the last 3 and 4 decades, has demonstrated consistently that you can actually increase ATP up to 500%. So you can get a significant increase in energy to help the body heal and be healthy and power the cells whenever you put any kind of microcurrent into the body. It also increases protein synthesis, which is building blocks for your tissue to repair as it's turning over, and collagen. And collagen is needed for all of your tissue to be held together in your skin. And for anyone out there that's interested in aesthetics or anti-aging with appearance, microcurrent is what improves collagen production in the face and on your skin. In 10 minutes, literally, you can look 5 years younger by using microcurrent. So the take-home points on that is microcurrent improves physiology, improves energy production in the body via ATP, and it helps the body heal. TENS will block pain, but it's counterproductive to healing, and it robs the body of energy. The last point on frequency specific is we have these lists of frequencies when we deliver microcurrent with specific frequencies for conditions and tissues, and we're actually able to target that, Dennis, so we can change inflammation in the body by up to 60% in 4 minutes. Now, anyone out there that knows about chronic disease right now keeps hearing that everybody is in agreement that chronic inflammation is behind it. So those are the differences, and then comparing microcurrent to using specific frequencies, we're actually able to target things and measure changes in the body, and it happens very, very quickly.
Great answers, by the way, and I'm sure you confront a public that's confused a bit about the use of current, because to them, they just lump everything together. I thought your answers were excellent. I just say that, hey, when TENS units were made available, I mean, they performed a great function. If you were in pain, you loved that little device because it got you out of pain. Unfortunately, it did so by a gush of current that just bombarded your spinal cord so much that it didn't allow the pain signal to get to the brain. Good for you that you had it. If you were in pain and you were suddenly out of pain, you loved the device, but it did nothing, and I mean absolutely nothing, and it looks as though it may have actually been deleterious for the healing process that you needed to really get better. So TENS units never made anybody better. They got everybody through a hump, and thank God they're there. Even thank God they're there today, because they have that benefit still available. But microcurrent's something completely different, and I thought your points were well taken. The mitochondrial aspect that you mentioned, I mean, this is the common link, as I usually describe with my patients, to all diseases, in that mitochondria have an optimum level of functioning. And if you're functioning at optimal, which is, I don't want to get any further in the weeds than this, Shannon, but I say for every mole of fat you consume, on your best day, at your best moment, your mitochondria can make no more than 36 moles of ATP. Now, I know that sounds pretty technical, but I mention it because this 1 to 36 ratio is optimal. And if you're at 1 to 36, you are a very healthy specimen. You are not ill. But if you are ill, if you have symptoms, you are not at 1 to 36. To get that ratio back, there are certain modalities that can do it, and the microcurrent appears to be one such modality. I just add that on to what you already mentioned, Shannon.
Dennis, thank you.
The experience now that you've had with using microcurrent, that it's just common sense and common nature to you, is something I'd like to be able to get my listeners comfortable with. You keep using the term frequency, and of course FSM, frequency specific. And if you could, this is maybe a difficult concept for our listeners to grab a hold of, but I got a feeling you probably know how to answer it. What do you mean by frequency? What is this frequency specific issue all about?
Well, right now, Dennis, if I can use the analogy, you and I are actually able to be on the radio for your listeners to hear us, because they were able to dial in on their radio station a specific frequency, so they wouldn't hear all the other radio shows. They were just hearing this one right now. And so there are wavelengths and there are frequencies, and that radio uses frequencies of waves in order for people to hear the sound coming through on that bandwidth. And we also use it to talk on our cell phones. So, for instance, today I am actually sitting in my home and I am using my cell phone to talk to you all the way in Pittsburgh. And the specific frequency that I'm using to bounce my information to the satellite and then to you allows us with no wires to actually be able to talk and then to be on this specific radio station. So it may seem kind of like strange space age medicine and Star Trek-ish to talk about it, but we're using frequencies all the time to get very specific to happen and information. Everybody uses frequencies when they walk outside and they click the clicker on their car and the headlights go off on their car and the door locks will unlock for them. And you can go into a mall area during this holiday season, Dennis, there might be 10,000 cars out there, and only their car will respond to that clicker. So that is the analogy for everybody to understand frequencies. And so we have specific frequencies, just like that, in specific tissues. And when we put those combinations together, the only thing that responds in the body if that problem in a specific tissue, just like you dial in on the radio, you use your cell phone to call someone, it's the same concept. So we have all those frequency combinations, and when we have been good diagnosticians and we have figured out through a long history with our patient and an exam what's going on, we can select frequencies that will probably be just perfect for what they need for their specific problem. And so that's what it means to use specific frequencies when you're using microcurrents. They are designed to target that person's issue.
What a great answer to the questions. It's so clear. You even made it clear for me, Shannon. And, I thought I had it pretty much down pat, but I think the listeners now can get into this issue of frequency specific and the fact that you as a clinician, I as a doctor, we can actually program devices to meet the needs, the frequency needs of an individual's medical status. After you sit down, I'd like the idea, and I'd really want you to expand upon it, that these are only, yes, they're specific to tissues, yes, but they're specific to people who have disorders because their own situation is unique. And when developing these programs, it's the uniqueness component that a clinician can gather through an extensive history and an exam to know how to make it an optimal frequency-specific program for them. You want to take a moment, because I know this is a big bugaboo of yours. This is not like one size fits all. And to even discuss that, I know get your hanger, your dander up. But go ahead, take a whack at this one. Okay.
Okay, Dennis, thank you so much. Well, I can, it's a really important issue to me anywhere in medicine for any practitioner or anything that you're doing to try to help anyone. Because unless you're an identical twin that had the exact same set of circumstances your entire life, which of course isn't going to happen, that would be the only exception. And we have got to take the time in medicine of all kinds to address the individual. So I want all of your listeners to please consider the fact that when they go in to see their healthcare providers and their physicians, a surgeon if they need one, certainly an eye doctor, an ophthalmologist, if you get your eyes examined, if you've got a really, really good eye doctor, they're going to tweak and figure out things that are specific to your eyesight. And if that wasn't the case, we would all just be able to walk in the store and get the perfect prescription because every possible prescription would be there for us and we could just pull it off the shelf. The reality is we can only do that with readers, based on power. So it doesn't matter if it's surgery, medication, microcurrent, acupuncture, massage therapy. It has to be targeted and specific for what that person needs with their particular set of circumstances and problem or complaint issues and where it came from and everything about their life, what kind of environment they lived in, what it was like growing up, what they eat, where they work, what their relationships are, and the specific types of injuries they had from really early childhood and even back into the womb. And then we've got to know a little bit about their genetics, which we can figure out by their family history. If you take a good history, remember Janet Travell told us the mystery is in the history. And if you do that piece of it, they will tell you what is wrong within the whole story, and they will tell you what genetics are in the family. And it's become incredibly clear, even with medication, that people are getting chronically over-medicated and under-medicated, even with some necessary and very important medications, because no one has individualized it to their particular weight, and they've not individualized it based on how their liver is actually functioning and metabolizing, leading to their level of sensitivity.
Well, it's just the perfect added touch to mention these programs are not one of a kind for everybody, that they'll be made unique to person's experience, that when we eventually meet a patient and figure out how we're going to help them, that history taking, and I agree with you, the Dr. Travell influence on us both was that phrase of hers, the mystery is in the history. And you talk to a patient long enough, they'll reveal like everything about them that has a degree of pertinence and applicability. And now we can take that and we can use this in frequency specific. So not only can we take devices and program them, they're frequency specific devices, but they're specific to a particular patient's experience, lifelong experience in developing what frequencies we're going to choose. Did I say that right?
You did. And I mean, I cannot tell you how many of my patients, Dennis, have come in and they're like, I have to have one of these devices. And of all of the devices that I have out there for my patients, not a single one of them is the same. And the programs are different. And in very, very, we'll call them standard programs that we have put together, quite often they're very specifically modified for each individual, but there's no two set of units that are exactly the same with all of the programs that they have on them. And it's the beauty of it where we can just make hundreds and hundreds and hundreds of different programs, and then we can individualize them for the person with their particular health history, with their particular story, with their particular needs. And the most important part, Dennis, is that I always put what I call my emergency medicine programs on every single person's device.
The basics. You call them the basics.
Yeah, and then the basics are in that for getting things to reboot. And then in the event if anybody ever has anything bad happen, they have these emergency medicine programs. So I just had someone who was on a long cruise and was really concerned about having to get that she might get a virus while she was on this cruise, and she was going to be way over in Europe. And I'm like, not a problem. I have a program for that, and I can put every single viral frequency that I have with every single tissue type, and you won't need all of them, but if you do need them, probably the ones that you do need are absolutely going to be in there. So I wrote this really great program, and she ran it the entire time, when she was on the cruise, just to be preventative in case she got exposed. And I've got programs for stomach poisoning and bronchitis. And so there's actually some emergency medicine. If something bad happens to you, we can just have those ready to go in the event of that. So it's great that we have this flexibility with these units and the ability to have all these programs available. And certainly, Dennis, you've heard me say before, when someone comes in, it's like, well, I've got X, Y, and Z. And my response is, we've got a frequency for that.
We have a frequency for that.
Have a frequency for that.
All right, let's do this. Shannon, we're going to take a short break. When we come back, I want to switch gears just a little bit. I think you laid great groundwork. If you even heard our last show, folks, I think today's show even amplifies it and makes it even a little clearer than that for everybody who's listening today. But we want to move into a specific arena, one that you're really adept with, and that is people who are injured, acutely injured, acute trauma, and how it is that microcurrent needs to be one of the very first things that you can do to get people back on track sooner, better, easier, and more effective. Let's talk about the acute injury situation when we return. Okay, Shannon?
That would be terrific, Dennis.
All right, folks. You're with Shannon Goosen. She's an expert on FSM, frequency-specific microcurrent. We're going to take a short break and come back and talk about one of the many applications, because we got a frequency for that. I love that phrase. We got a frequency for that. We're going to be talking about frequency-specific use in acute trauma when we return. Be right back. Good morning, ladies and gentlemen. Welcome back once again to AM Impact on Your Health. Here on a Monday morning, Microcurrent Monday morning here on KHB AM Radio. Our guest today is a good friend of mine, many years, and so intelligent she is on matters of frequency-specific microcurrent. We got a paradigm shift happening here right now as we speak. This is coming to Western Pennsylvania. It is available in my office, but it's going to really burgeon and become an awfully large practice of large part of my practice. And the expert herself, Shannon, will be here many times to help convey how effective this can be to you and have a chance to meet her. Now, Shannon, you did a great job this morning in trying to describe what frequency-specific microcurrent was, and your exposure to it, and maybe the earliest days of that exposure. I often ask people who come to me with my radio shows, and I'm going to ask you today, did you have an aha? Somebody presented the issue of microcurrent to you at some point in the past. You had questions. You may have had doubts, maybe very similar to what our listeners may have as they're listening to us today. But there was a moment. I oftentimes refer to it as an aha moment, where at that moment you go, oh my goodness, can this do this that well? Oh, I've got to use it for others. Could you please, for my listeners' sake, do you have an aha moment? And if you do, what was that aha moment? And allow my listeners to benefit from your revelation that was made to you at that time, because they're going to have the opportunity to have their own aha moment sometime in the future.
Well, Dennis, I'm going to go ahead and reveal this on radio, I guess, and in order to just tell the truth on what happened. I was actually on the receiving end of some really terrible injuries, including a motor vehicle accident where my head hit the windshield. And I did have a head injury from that, a very severe neck injury, and a bit of void surgery, though. And then no more than 3 years later, I had another injury at work from lifting something that I shouldn't have been, but I just wanted to get the job done, and ended up in an ambulance on my way to the emergency room with a pretty severe low back problem and herniated disc, bulging disc, 2 levels, could barely feel my legs for a while. Managed to stay off the operating table for that one also. But Dennis, I basically was on disability for close to 3 years, and really did not think that much was going to come of my life. Getting introduced to myofascial pain treatment was the first thing that made a difference. But what really took care of everything in the end was running a set of frequencies that we call 40 and 10, which is inflammation in the spinal cord. And Dennis, I got rid of all the pain that I had in my body that I had been living with and accommodated to.
Like how quick?
My aha moment was getting rid of my body pain, not having it come back, not having myofascial pain anymore, and being able to address that old head injury that I had from the motor vehicle accident, which so many people have lived through. And Dennis, then I immediately got to apply this with my patients, and I was able to help people that had these diagnoses of fibromyalgia. They had pain anywhere from a 7 to a 10 out of 10, which is really worst pain you could imagine. And we were able to get rid of their pain in less than 90 minutes and take it down to between a 0 out of 10 to a 2 out of 10. And that was my aha moment for the power of microcurrent. Because if we could treat everybody with just that one condition and trauma-related fibromyalgia, we could just change people's lives so quickly. So that has been my passion for the last decade, and it works.
What an attention grabber! Because we met because of your chronic pain issues, musculoskeletal as they were, but we never could take it over the line. We never got you to the point where you had complete relief. Almost every time I ever came to Jacksonville, we had to meet first for about 45 minutes to get you so you could even walk, okay? And it got you through these moments, but I am so impressed to hear that when you had an acute event over top of that chronic, I don't know how to describe it, Shannon, you were a mess, okay? So you have an acute injury now on your way to the hospital on top of chronic, who knows what's under there. And you're telling me you got rid of the stuff in 90 minutes? Is that what you just said?
Yes.
No. Really?
And yes. And then it just got better and better. Dennis, I'm 51 now. I feel better and I think I look better than I did 20 years ago. I am running now. I am doing everything that I had essentially been told that I wouldn't be able to do. And most importantly, Dennis, I'm no longer afraid of anything acute happening to me, because the thing that we also do so well with microcurrent therapy when we use these specific frequencies is we can treat trauma. And if we can get a hold of people within 6 to 12 hours, but ideally just immediately after anything bad happens, we totally change the outcome. And I've had those bad injuries, and I've been able to heal myself in impossibly record time and get over that. And the big aha on trauma was when Terrell Owens was in Jacksonville, Florida. I think it was 2005, 2006, playing in the Super Bowl here. He was with the Philadelphia Eagles. He had had 6 weeks earlier a horrible injury. He broke his ankle, tore his deltoid ligament, had to have surgery. The doctors and everybody told him it would be 4 months before he was going to be completely healed and be able to play. By golly, Carol was sent him at the hospital. They had microcurrent on him right after he came out of surgery. He had one of these devices at home, treated himself every day. He was here in Jacksonville with some other things, and then we used some special techniques that I used to reboot the brain and get you to be able to walk normally. He played in the Super Bowl, got most valuable player in that.
I remember this.
Injury.
I remember this. I didn't realize you've had a role in it.
You know who the people are behind that. He did hyperbarics and everything with it, but radiographically, he was healed at 4 weeks. And as you know, as a doctor for that kind of injury is impossible. And I was sitting here with an orthopedic surgeon who was retired at the time. And he's like, you should not be playing. That is impossible. And Carol and I are sitting on the couch. It's like, he's healed. He's fine. He can do this. And he got most valuable player. So that's the power of what we can do with specific frequencies when we use microcurrent to treat trauma. So if anything, this actually, Dennis, should be in every emergency room in the United States. Everybody should have one at home if it was just to treat trauma if something bad happened, or make sure that you know a practitioner that can see you immediately, which is what we do in our office. You know, if something bad happens, you need to call us immediately after whatever phone call you need to make first to get yourself taken care of, whether it's a friend, the emergency room, an ambulance. Do that, but then we need to be the person that you call next so that we can make arrangements to get the current on you. And Dennis, I just set people up in the waiting room if we're out of space. And we've got 8 treatment rooms in my clinic. Everybody in the clinic knows if something bad happens, the person that's available will help get someone set up on microcurrent in the waiting room if that's where we need to set them up. And then we just let the frequencies do what they need to do, take down the bad inflammation, activate the good inflammation and the healing power within the body because it's already there. And Dennis, I have healed broken toes in 2 weeks in ballerinas.
Oh yeah, you told me about the ballerina. Was it the nutcracker or something? You got to tell my listeners about the ballerina who got selected to do nutcracker, and then something cracked on the ballerina. Go ahead, take it away.
Yes, well, her partner, it happened. He dropped her. And she broke her great toe. And I am here to
for a ballerina.
Dance and if you dance on toe, in the nutcracker, which everybody is on toe, you can't do it if anything's broken down there. So they knew the call, had her in on her right away, and I got her in with an orthopedic surgeon because that was the appropriate thing to do. They did x-rays. We did everything medically by the book. She was doing great. After 3 days, she had no pain. She really had no pain after the first visit. Completely took care of it. And I had her be very, very cautious. They had told her that she wouldn't be able to do rehearsal. She wouldn't be able to dance in the nutcracker because there was no way it would be healed in time. She went back to the orthopedic surgeon within 10 to 14 days. He was convinced that it had healed. and he allowed her to go to practice, but not on point. And then when everything was clear from that, they did x-rays, it was healed, and she was cleared to do the dress reversals before Nutcracker, and she performed.
How long was that total span of time from injury to back on point?
I think it was 3.5 to 4 weeks. It was probably close to 3 because she got to do the dress rehearsals before Nutcracker.
This is great. That's great. So, as the listeners getting a feel for, one of the things, of course, microcurrent shines for everything. I love that phrase. We got a frequency for that. It doesn't really matter what the problem is. Microcurrent will have a role to play, but we're just isolating out today one category of patients that absolutely need to consider this with respect to their own selves and their own families when they're acutely injured. We want them, we encourage them, we compel them. Please get the emergency medical care you require. Go to an ER. See the conventional medical world. There may be things that need to be intervened with, and if so, you don't want to be bypassing that step. I know sometimes it's laborious, and you think, oh, I don't want to go to that ER again, but really, you have to. But Shannon, as you and I both know, we should just reveal it now. A concept has emerged in Jacksonville. We talked about it. We're taking the show on the road. And what comes out of this is something we refer to as second call. Now, I'm going to let you talk about second call as you envision it, and let our Pittsburghers know that in January, when we launch second call, they're going to have the ability to have their problems dealt with in a very similar way that T.O. or the ballerina did, okay? But it'll be for their own particular injuries. How is that working for you in Jacksonville? Describe the ideal as you see it.
Dennis, with what we know and what we've seen, with how quickly we can change the outcomes for anybody that has had any kind of trauma, I believe that people need to be able to have access to practitioners that know how to apply microcurrent and then can teach them how to do it for themselves. And you said it correctly, you never, ever want to bypass the important medical steps that we need to take when there's been trauma, because there is, in fact, times where other things happen that you wouldn't know about unless someone does the correct imaging. So we always want the most amount of information possible in the beginning, and we need to make sure that people have the appropriate care, that they get slings, that they get casts, that they have appropriate imaging if they've had any kind of soft tissue injury in the abdominal area, and they follow whatever those protocols are.
Well, that's what
that is taken care of. If we get the frequencies on people, we can heal them at lightning speed.
Well, I just want to interrupt 1 second. So what should be first call doesn't change. First call, I think, is 911, isn't it, nationwide?
Yeah.
Or if you don't have an ambulance.
Really that happens, you call 911, or you make sure that someone is taking you to the hospital, taking you to an acute care center, someone that can do the medical workup. So that first call is 911 or the person that is going to be able to make sure that you get the acute medical care that you need by an appropriate healthcare provider, doctor, or facility. Once that's in place, Dennis, the thing that you brought up and said to me is like, oh my gosh, Shannon, then they need to call 1011. So you call 911 and then 1011. And that number, Dennis, I think now belongs to you in Pittsburgh, right?
Yeah, you and I communicated by phone. You saw immediately the need to secure it. We have a nationwide number. We'll be describing exactly how you use that number by the time we meet again in December. But folks, the groundwork is laid. You here in Pittsburgh need to know that your medical needs can be met just like T.O. and just like the ballerina, because your injury is unique to you and you have your own sort of healing requirements that need to be put in play. And so after the emergency room visit, after you've been seen by the conventional world, which we call first call, it needs to be an opportunity to make and then to follow up with what we'll call the second call. And we launched that January 1st. through the help of Shannon. And Shannon, you, in a way, already have this thing going for your patients and down in Jacksonville. Describe for us and for my listeners some of the more interesting cases that you've already managed by somebody who needed emergency help and then saw you right afterwards. I mean, that they made that second call, I think, while they were in the ER, correct?
Yes. And so we've had many fractures because I have athletes that I work with. But then even across the street, there is a business over there with lots and lots of employees. And the owner of that business owns 2 of his own microcurrent units for his staff. But he had one of his staff members break her foot falling over something. And so we got the call when she was in the emergency room. So as soon as they got that foot stabilized, he was in our office and we ran microcurrent on her for 3 hours. He ultimately needed surgery. We ran current on her in the holding area. They call it ASU before she went in for surgery. And then she had current after surgery and ran it at home. So we've had anything from workers who get this, and he does this to keep his workers' comp costs down. So this is a smart employer. He knows that if he can get people in on second call for the things that happen for them, that it's going to reduce his workers' comp costs. So that's how it gets used in that type setting. And then, of course, with athletes, getting them back to their play and doing what they want to do in their professional sport, we just put people in the waiting room, and whether it's sprain, whether it's a joint injury, whether it's a fracture, whether it's a severe muscle.
All right, Shannon, look, this is a terrible time to interrupt, but maybe a good time to interrupt. We're right at the end of the show. We're at a crescendo moment. It lays the groundwork for our show in December where we're really going to take the roof off of this thing. Second call is coming to Pittsburgh. Shannon, I want to thank you so much for being with us today, sharing with us your knowledge of microcurrent, and dangling that carrot out there for my listeners and for the Western Pennsylvania people to know that it's coming to them too. Talk to you soon, my dear.
Thank you, Dennis.
All right, there you have it, folks. Shannon Goosen, second call coming to town. I'll see you on Wednesday. Until then, this is Dr. Dennis Courtney with Shannon saying so long for AIM Impact on Your Health. Are you there?